The success or failure of your diet or any supplement protocol that you're on could be hinged on what we're talking about today. This could be the most important talk we've had so far. And luckily, we've got Dr. LeMay with us, who has brought us back to reminding us what is most important about addressing your health when it comes to holistic health. So very, very happy to have him with us today. And Dr. V, I'm going to pass it to you and let everybody know that he's still here. And he was 2 minutes early to the call, and he has a broken rib from this weekend. Crazy stuff. So
I'm still a kid at heart.
exactly. I often talk when people ask me about, how do I know if my digestion's not working, and I talk about, passing gas and having burping and belching, but there are specific headaches that we want to make sure people are aware of is what's going to bring you to know whether or not you need to keep listening to this talk. So Dr. V, talk to us about the headaches that are associated with what we're going to talk about today.
Yeah, great. I mean, in fact, the three most common headaches are related to today's subject, right?
Wow.
And those headaches, the book is called The Headache Advantage. Advantage because the advantage of head pain is it tells us the priority, the main weakness in the body, right? And so we've got frontal headaches, which typically means stress is compromising the stomach lining, right? So if you have a frontal headache, then hey, we need to heal the stomach lining. We need to handle that stress, which is why most of the people are going to be taking the medications that Dr. LeMay is going to be talking about today. Then the other headache is the right-sided headache. That is a gallbladder concern. That means the body's not producing bile properly, and that is typically what sets up the heartburn, the reflux, the GERD, gastroesophageal reflux disease. And so if you have a right-sided headache, gallbladder is where you want to target your energy and your health pursuit. Then the other one is the left-sided headache. That means low stomach acid. That means that your body's not producing enough stomach acid, and you definitely should not be taking the medications that we're about to talk about because, as we were talking about before we went online, I mean, stomach acid plummets as we, after age 25, it keeps going down. And so if you're already heading down in that front and you block that stomach acid, you've got a world of hurt heading your way. So stay tuned. We're going to talk about these headaches as we go through. We're going to help you understand why you really probably should not be taking these medications that are compromising one of the primary pathways in the body. And I'm going to be listening because I need the stomach acid to make bone health to heal my rib. Doc, tell us what we need to know. Dr. LeMay.
Well, hey, first of all, thank you very much for letting me be on this. This is just a real honor for me because I've gone to both of your seminars. I remember last time I saw you, Dr. V, was back in 2022. You came up to Northern California to teach us, and hopefully sometime you'll come back again. So that'd be great. And of course, Dustin, he's running around. We will see him at some point.
All over the country.
But thanks again for having me on here. And just want to let you know that with all of my patients, this is the first thing I'm going after. I'm going after their poor digestion because most people don't even realize this is that as we age, our stomach acid is decreasing. And so when I get people coming in to see me, and like I just had a person last week, she comes in, she's like, age 75, and she's like, what the heck is going on here? I feel like I'm falling apart. And I'm like, well, again, all your symptoms that you're having, the bloating, gasiness, acid reflux, all that stuff is because you don't have too much stomach acid. You actually have too little stomach acid. And it's interesting because we're talking beforehand and Dustin pulls up this great book right here, why do I need stomach acid? And again, why is it important for you? Because as we age, this chart right here out of the book shows how it's going downhill. And their doctors are telling them
that they're probably not going to be able to see that. So that's stomach acid, the left side of that chart. What their stomach acid is at what age? Is that 20?
Well, it's starting like age 10 to 20, going all the way down to age all the way down. Yeah, good stomach because your body is producing hydrochloric acid to be able to break down protein. Also get your minerals in this solution so you can heal like rib fractures, stuff like that. And basically, because people are just like going, my doctor keeps telling me that I've got too much stomach acid and I've got to get rid of that stomach acid. So I got to be taking my Prilosec, because that's going to help get rid of that stomach acid that I've got too much of. And it's like, no, that's not the way the physiology works. If you read I always tell people, it's like, hey, here's my great book. It's Guyton's Medical Physiology. What does it talk about in there? Stomach acid. What happens if you can't break down protein? You're not going to heal. If you can't break down your minerals and get them into solution, guess what's not going to happen? You're going to have osteoporosis. You're going to get fractures down the road. All these things are going to occur. So why would I want to shut off the most important enzyme in my body, hydrochloric acid? So I am just blown away when I see this all the time. And I'm not kidding, like Prilosec. It's interesting if you read up on that medication. I mean, it's supposed to be used for helping people to heal ulcers. And you can only use it for like 3 6-week protocols a year.
Right.
Okay. And I cannot tell you how many patients I have seen have been put on that medication for 2 years, 5 years, 20 years. And it's like, oh my gosh, and so what does their stomach look like after that much time? Right. They're not making any hydrochloric acid whatsoever, because Prilosec will basically take away, or omeprazole will take away basically if you take one dose of that, it can go for 24 hours to 3 days as far as shutting off your stomach acid. You're making none. And of course you feel good, but what's the down road problems with that?
But do you feel good? You just don't feel pain anymore. For those of you following along at home, it's page 20 in the book. I say that because every new client for the last several years gets a copy of this book when they come to my clinic. So I don't know if they ever got to page 20 and actually reading it. So that's why we're doing this together. But it is in there. Yeah, the exact chart. I like how you blew that up and made it look better, though.
Well, I can tell you one thing I had. This is just an interesting story, because I love to tell stories, right, Justin? Yeah. So I had a patient of mine who was also in his late 70s, and he came to see me because for 2 years his doc had put him on a proton pump inhibitor. And he's still an electrician. This guy just loved to work, and he was still an electrician. But he told me the reason he's coming to see me, because he goes, gosh, I'm having these weird symptoms. I'm like, well, describe it. He goes, well, I'll be working on somebody's house, and all of a sudden I'll just stop. Like I'm like frozen. I'm like, I know what's going on, but I can't move. I'm like, I'm stuck in my body, and people are coming up to me like, are you okay? You okay? And he's like, I can't move. He goes, for like 5 to 15 minutes, he could not move. He was having petit mal seizures. Wow. And his doctor's like, I don't know what's going on here. I said, well, I know what's going on, because if your body cannot break down protein, which is what your body breaks it down to the smallest, molecule, I mean, as far as like amino acids, what if you don't have the amino acids for brain function? Right. What's going to happen there? Are you going to have problems with brain function? The answer is yes, you are. So once we started to get him off of the proton pump inhibitor, his petit mal seizures were going away. But he kept on arguing back and forth with me, because my doctor says this, the real doctor tells me this, and you're just a functional nutritionist. You're not a real doctor. And I said, okay, that's it. I've had it. I go, either you read this book or I'm not treating you anymore. And so he goes, okay, fine. So he gets the book, reads it, and goes right to his doctor and basically chews him out. He goes, what are you trying to do to me? It's right. Nice. And so I said, there you go. You just need to know the truth. And again, like we do this all the time, Dustin, giving him that book and having him read it. But I make demands on my patients that I expect you to read and do the things I'm telling you to, or I will not accept you as a patient. I will fire them. Because I mean, it's kind of a tough love thing, because when if I start getting too much pushback, I'm like, okay, this person doesn't believe me. So you're going to get an assignment. If you don't do the assignment, we're done. So he did his assignment, and boy, he got better and he stayed better.
Well, that's the difference in empowering somebody with knowledge themselves, right? When they know it, when it's their idea, they own it. And that's the goal. That's what we really want for people. That's why we do this. That's why we do even the talk, right? To get people that own knowledge. And for Dr. V and I, we start to go down all these really deep rabbit holes, right? Trying to figure out the mysteries of life. That's why we're so grateful that you brought it back to the top, because I can't tell you how many times early on when I would be trying to help somebody who stayed with a migraine, and I would be like, well, let's rule out magnesium. Let's rule this out, because she didn't report anything that would make me think she had low stomach acid, no headaches, no, she didn't say she had any gas. But the third visit, when I was frustrated and I couldn't help her, I could smell her burp from across the table. And I was like, oh, okay. We got her stomach acid back up and the headaches went away, right? Well, migraine headaches. They weren't frontal headaches necessarily, right? They were these migraines that she was calling them.
that's one of the ways to test for low stomach acid is drink a bunch of sodium bicarb and see if they burp, right? So basically inhibit that stomach acid, and if you burp, that's confirmation that it's low. And Dr. LeMay also talked about this and brought it, but we need to help people understand if they have low stomach acid, certainly long-term consequences, osteoporosis. You kind of went through that quickly as you were going through, but the others, you pair poor stomach acid, low stomach acid, so that you have those too large of proteins. Combine that with some stress that causes leaky gut, and now you've got arthritis as well. So, and all these other immune allergies, right? That's too large of proteins getting into the bloodstream, triggering the immune system. So allergies are going to be side effects of low stomach acid that a person could create by blocking it with a medication, right? Or just simply stress that mimics cortisol inhibits stomach acid production, right? So there's all these mechanisms that go into it to play, and that's why kind of the headaches give us the pattern of the headaches give us a nice indicator to empower, as Dustin just said, to empower people to know where to direct their energy and what to do to get better. The body needs stomach acid. God put it in the top of the digestive system for a reason, right? I mean, we need to break those proteins. We eat a steak or, chicken or turkey or fish, and we've got that large protein that needs to get broken into amino acids to then use those amino acids to feed the brain, like Doc was talking about, to, to drive the immune system, to make neurotransmitters, to balance, stabilize our mood. So, I mean, all these downstream mechanisms of blocking that stomach acid that are just catastrophic. I mean, think of all the joint aches that, go along with, I mean, we talked about, statins and that sort of stuff previously on a previous thing, but it's the same sort of joint pains that could go along with blocking stomach acid as well. So just to kind of keep people engaged to help them understand what the mechanisms are. Yeah, if you're burping after a meal, it's not an Italian compliment that, hey, this was good food. That means your stomach acid could use some help, my friend.
Well, and I think to Dr. LeMay's point, it's just having them read the insert of the actual medication alone, right? I think if there's a takeaway from this, if you're taking a medication, just confirm. I think people just trust automatically that because the doctor gave it to them, they should be able to take it, forever or whatever until somebody tells them, and they're not being told to stop it. They need to know that, like you said, I think you said 6 weeks. I've actually read on there that it's 2-week, 14-day therapy is the maximum that it should be.
Yeah, that is
and
correct.
They're not supposed to repeat it for 2 to 3 months. That alone, people have no idea, right? They're just not being told that. And that's worth sharing with anybody who's listening to this now.
And Dr. B, you said two very profound things just a second ago here that I wanted to kind of point out too, because you're talking about a person's immune system. I mean, right now it's, late March. And again, it's like we're coming into like around here, it's like allergy season. Right. And my patients, I tell them, it's like, hey, if your gut is working really well, I mean, because like 70 to 80% of your immune system is down here in the small, large intestines. If this improves, guess what happens to your allergies typically? They lessen or go away. I see this over and over again when we fix people's digestion. And then again, it's just their ability to be able to, heal and get better. I mean, that's just amazing. And again, it's like, that's really profound because a lot of people are like, man, why do I have allergies during this time of year every single year? And, why was my body not seeming like it's repairing itself and getting back to normal like it used to when I was younger? Well, it's because you don't have the stomach acid to be able to break things down and get them into solution and utilize them.
This is an area where I think we have definite polarity in the allopathic model, right? Allopathic model, we just call that, for the typical medical persona or perspective, is to suppress stomach acid, where we are all about, in the natural health, functional health arena, we're all about rebuilding that stomach acid. Complete polarity. I mean, most of the time when somebody tells me they're on a drug or something, I can use the mechanism of that drug to kind of identify where their weakness is or what we need to do to rebuild them. This is an area where, like Dr. LeMay, your patient had, that complete polarity that we're going to be kind of boxing with the MD, if you will, because we want to get them better. The symptom management of an acid blocker just is really catastrophic down the road.
We're also a little bit boxing though with the fact that they are in pain, right? And that's the thing that people will bring them back to the acid stopper because they're like, this hurts, right? The acid indigestion hurts, but if you give them the right things, that pain can go away very fast if you're given the right thing. Wouldn't you guys agree? I mean,
Yeah,
for
it
those
does.
who are watching this and are saying that to themselves, yeah, but if I stop taking my acid stopper, I'm going to have this pain. What would you say to that person?
Right. Are you going to tease them? Or are you going to let them know what we all use
You
to
go
get rid of
ahead. You
that
guys take it
pain?
Well, and again, it's like well, I always like telling stories because again, it just really kind of drives this kind of point home because like when you use a medication appropriately, and again, that's the biggest thing here that I'm trying to point out to patients all the time. If you use that medication appropriately, it's going to work great. Like I had one woman, she was 90 years old, and basically she was having ulcers and it was bleeding ulcers. It was really bad. So they put her on this proton pump inhibitor to help the stomach to heal up because most people don't realize it, but the lining of your stomach turns over really quickly within days. I mean, like 24 to 48 hours, it turns over. It's like that. So they put her on this proton pump inhibitor to help stop the bleeding, kill the ulcer, do what they're supposed to do. And it was great. So they did that. But at the same time, they just left her on it for 2 years
Right.
and just never stopped taking her off that. And so what happened is when I saw her, she had neuropathy in her hands and feet, couldn't feel her hands or feet. And then I asked her a couple other questions. I'm like, can you smell anything? She's like, nope, can't smell anything. I go, can you taste anything? She's like, nope, I can't taste anything either. And I'm like, oh boy. So I just put her on just two things to see if this would bring her back. I put her on chlorophyll complex and I put her on some Catalin, just two
Wow.
basic things. And I sent her away and I said, come on back in a week and let's see how you're doing. I mean, she came in a walker and she could barely move. She's just going so slow. And so when she came back with her wife, she just booked into the room and sat down and she looked at me. She goes, I think those supplements are working. I'm like, I think they are too. So, and she was fine after that. We got her healed up and got her back to normal again. And she lived, into like her late 90s before she finally passed away, but she did great.
Wow. Do we know if she had osteoporosis and how much that reversed with the little changes you made?
That's one thing I never did get to because again, she was just happy she could,
function.
She could function again. I mean, the neuropathies in her hands and feet never really went away because it was just pretty bad damage,
So we need stomach acid to activate B12, right? So, and B6. So that's our nerve conduction.
Yeah.
So that was part of the mechanism that was going on for her.
Yeah.
Zinc, we need zinc to make stomach acid. So the three primary nutrients to make stomach acid is zinc, calcium, and B1, right? So we need those. So if a person has trouble smelling or tasting, which got a lot of press through COVID years, um, zinc would be a great place to start, right? Maybe we need to we need the building blocks to make that stomach acid. Calcium, it's a kind of a conundrum because we need calcium to make stomach acid and buffer the stomach, but we need the stomach acid to break the calcium down to metabolize it. So we need to break the cycle right there if we've got bone health issues and we've got low stomach acid concerns. So that helps us know which one. And then B1 helps with a lot of neurotransmitters. It helps us helps gals break down estrogen, helps make energy. So if we have signs of that, then maybe it's a B1 deficiency that we might want to look at. So the body's telling us a story ultimately, and all these signs and symptoms can tell us really what the trigger is. Again, just to kind of be a bit of a broken record, it does lead back to a headache to kind of answer my earlier question and prompting, how do we know what supplement's going to help prevent that acid stomach that they were feeling? If they have a right-sided headache, then it's a gallbladder concern, and right-sided headaches are far and away the most common headache I see. So we need to take a supplement like beta food or, eat more beets or AF beta food to help the gallbladder function better to heal that esophageal opening where the stomach slips up through into the diaphragm. So if it's a right-sided headache and they're taking a proton pump inhibitor or an acid blocker, then we want to look at fixing the gallbladder, and that would be their antidote, right? Oops, I'm getting heartburn. Take this beta food. That stuff, you can take that, tons of that all day long, no problem, So that's easy. If it's a left-sided stomach headache, that's the more traditional ulcer that, allopathic medicine is trying to block the stomach acid for. We want to heal, look at the nutrients like I just talked about, the zinc, copper, the zinc, calcium, and B1 to make stomach acid, or maybe a product like Zypan, physically take it if the person's burping across the table and it's stinking, like Dustin got exposed to, they probably want to just start with the supplement like Zypan that has stomach acid in it. If they're the consummate headache of, the head and the hand kind of frontal headache, that means high stress hormones. Cortisol is inhibiting the stomach lining. Ultimately, what that means is causing a deficiency of norepinephrine, which is creates that buffer. It creates the stomach. It enhances the stomach lining. So under chronic stress, that goes low, and we lose that mechanism to protect the stomach lining. So ultimately, with that, also they're going to have focus problems, ADD kind of symptoms, trouble learning, retaining information, because the information is not getting stored into the brain there. So this is how the body can speak to us. If we can, as we learn to listen to and what it's trying to tell us, then we know what direction, what mechanism to go as far as, what sort of supplement to take as your buffer, as your antidote to get off of these acid blockers and reduce the dramatic consequences that they could ensue.
For those of you out there who've been on them for a very long time, right? You may get this idea that that's not going to be enough, right? It's worth ruling it out right away. Do the B1 thing first, right? Do that Zypan thing first. But I have found that somebody, like I've recently worked with somebody who was on it for almost 30 years, I think. And in order for them to get back to where they don't have to be dependent on something like Zypan to help them digest, I had to make sure that we took care of his pituitary, right? His pituitary for the signaling was very important. And that was key for that individual, right? Getting that signaling going. Of course, bitters were helpful for that too, for this individual. But a piece, there's a lot of practitioners that watch this, and I just want to remind them that sometimes there can be a lack of strength in that lower esophageal sphincter that needs manganese to be able to strengthen. And for me, the key that helps me think whether or not they need that is whether they have any type of hernias, like herniated discs, hiatal hernia, inguinal hernia. If they have those, that to me speaks to a potential long-term depletion or lack of manganese to keep ligaments nice and strong. And so something like Ligaplex 1 or anything that would be a manganese thing has also helped to be able to heal it so that it doesn't recur. I don't know if you guys find the same thing or not.
Well, another symptom to throw into the mix on low manganese, manganese helps drive P450 pathways. So if we don't have the nutrients to drive that first phase of detoxification, chemical sensitivity is a symptom that could be thrown in the mix with that manganese deficiency.
Nice. Right. Which could also be interpreted as a low stomach acid situation too.
Right, huh?
Right.
Like the allergies, like we were just talking about almost. Right.
So yeah, if we don't get this first, everything else can be a mystery, right? That's why I think it's so smart to start there and rule that out. And that's why it's in the is it your second headache, first headache?
The book. First headache is gallbladder, second headache is stomach.
Okay.
Low stomach acid, yeah.
And you need stomach acid to trigger the release of bile from the gallbladder. So there you go.
Right. Chicken or the egg.
Right.
Cart before the horse. Right.
Well, I was going to mention one thing real quick here too, because again, like most people always ask, what's causing this problem I'm having? And I tell them it's number one, it's your age. And number two, it's your standard American diet, which is the SAD diet, which is really bad. And so that's the main causes of people having this kind of an issue that they're having with their digestion. But then also, people are like, well, what's so bad about taking this, acid blocking medication? I feel good when I'm on it. And it's like, well, down the road, here's the dangers of that. And this, you can go look this up online. If you go to like drugs.com and look up your favorite medication you're on, you can see this right here, because the top ones are basically renal, liver, and pancreas impairment. Those are, main things that you need for your digestion. These are digestive organs. Fractures and respiratory infections, abdominal pains and flatulence, vomiting and headaches, like we're talking about right here. Again, that's a biggie, because I have one gentleman, I saw him 6 months ago. He was throwing up every morning for 2 years, every morning. And the doctors are like, we don't know what to do with you. He came to see me, and within 2 weeks I had him, and he's no longer throwing up. Because
stomach acid should be its highest in the morning. That's why we want to eat a good high protein breakfast while our natural circadian rhythm of stomach acid is there.
Give me the time frame on that, Dr. B. What hour, from what time to what time is the best time to eat that breakfast in your opinion?
7 to 9 a.m.
7 to 9 a.m. Okay.
So
the people who skip breakfast and they're doing intermittent fasting, they might want to move their eating window earlier in the day, right? So they're eating within that window and just stopping eating earlier.
Stop earlier in the day and start with the high protein in the morning. Right.
Gotcha. Great idea.
Great point.
Because there's a lot of people doing that now, right? They just think, well, I'll just drink coffee, and I know a lot of people do that, right? They wait until later and they only eat one meal a day. So if you're going to eat one meal a day, it might be to get that high protein in the morning is going to be important. Okay.
Right. Dr. LeMay was on a rant there, and I interrupted.
Oh yeah,
Carry
sorry.
on.
No, that's okay. That's okay. That's what we do around here.
Keep that rhythm going.
No, I'm just saying that, it's like some of the things you were talking about, long term, you get B vitamin deficiency, B12 deficiency, fundic gland polyps, which is long term use of proton pump inhibitors. And then, of course, people getting joint pain and dizziness with long term use of proton pump inhibitors. And so when I'm seeing these kind of things all the time like that, I'm always looking and because a lot of times people, when they come up with their symptoms, I look at their medication list and I just go through and I say, look at all these different symptoms that are related to what you're complaining about. And they're like, my doctor never said there was any problem with the medication.
Yeah.
I don't know, but that's what it says here. So I'm just going to tell you, like, if we start getting you off of some of these things, and the first thing I go after on the medication list is any kind of acid blocking medications to get them off of that. Because I cannot do anything until I get rid of that. And it can take a process, like you're saying, like you had, Dustin, you had somebody, 30 years?
Yeah.
Yeah. The longest I've had is 20 years. And it took me a year to get him off of that. And there's a specific acid weaning protocol for, getting somebody off of proton pump inhibitor and stuff like that. You got to know what you're doing, because you got to heal things up and get that stomach and digestive system, the upper portion, working properly again before you can move on to do anything else literally with these people, because
there's a catch-22 with that, because you need zinc to be able to make the stomach acid, but you need stomach acid to extract zinc out of anything you're taking. So you got all these people taking these zinc supplements but not getting any value because they don't have the stomach acid to extract it.
Correct.
So that's why it can take so long, because you don't need zinc just for that. You need it for everything else in your body.
Right.
And let's zoom out a little bit even more to really paint this picture clearly. We're made of 100,000 structural proteins. All of that building blocks for that come from the proteins we eat. 60,000 regulatory proteins. If we're not breaking down the proteins into amino acids, we're just not replacing those things, which is accelerating aging, right? That's it. That's the end of it right there. So
yeah, and again, just like you need stomach acid basically to protect you from all these different things that are coming into you, as far as like viruses and bacteria and helminths and flukes and worms, all that kind of fun stuff. But again, it's like even if you got rid of all of those, but then of course you throw H. pylori in there, and it's like H. pylori swims in stomach acid and loves it. And so 35% of the population has got H. pylori, which would be like in America, that'd be like 136 million people. And so you have to deal with that. But of course, we've got things that will help with that, like licorice root. Okay, that gets rid of H. pylori. So again, it's just like we have solutions for these different things that they're not going to get from their allopathic doctor, their MD.
Right.
Licorice, see, I use echinacea on H. pylori or oil of oregano.
You can. There's some more right there. See, that's a great thing. It's like, God put on the planet all these great tools we can use to get rid of stuff. It's amazing.
And the food to help stomach acid is ginger, right? Herbal bitters, as you guys had mentioned.
Yes.
Wormwood and ginger. So if you're eating sushi, where we need the stomach acid to kill those helminths, the parasites that might be on that sushi. So there's a reason ginger and wasabi are in there. Some Asian wisdom with that, right? So eat the ginger with it. That stimulates the production of stomach acid. Even best to eat it a little bit before you start eating that sushi, to tell the body it's time, we got some protein coming. That starts priming the pump, if you will, to make stomach acid, which will kill those parasites. Stomach acid is our first line of defense against parasites. When we eat, say, sushi or lettuce or something, they may have parasites in it. So typical mechanism for parasites, they cause joint pain, or brain tumors or digestive distress. I mean, that's low stomach acid, parasite getting past it, and then it's party time, then the parasite flourishes in the intestines. So eat the ginger, and then wasabi. One of the companies I use literally has wasabi capsules as part of their anti-parasitic protocol. So wasabi is very anti-parasitic. The soy sauce is a little bit of a side note, though. Soy sauce is very excitotoxin. It's very toxic to the brain. So rather than use soy sauce, to use that to get that wormwood going on, and I use I use lemon. So lemon juice, I put lemon juice and the wasabi, mix the wasabi into the lemon juice, and that's what I dip sushi into. So that helps kill the parasite. And then I eat the ginger in between as well, right? So that helps stimulate stomach acid when we're eating that protein, eating the good fats of the fish, and then we can kill the parasites on contact. So another kind of pearl, if you're eating, and if you're concerned about, transitioning, if you will, get in the habit of eating ginger with your meals. I mean, that's a nice way to smooth the transition. And then back to your, healing the intestine. I had Antonia, a gal that was in her 70s. They came to me with the tissue in her mouth, literally spitting up blood. And gave her Cataplex B, gave her which is thiamine to help make stomach acid, and I gave her ochrapepsin to help heal the intestine, all the mucus bilayer in there, heal up the stomach, and within 3 days, actually the next day, all the blood, she quit spitting up blood, and most of those symptoms went away.
That's amazing. I mean, it's just so cool to watch people heal so quickly. They're just like, and they look at you like, my gosh, this is like magic. And I'm like, no, this is just physiology. We're just working with your physiology and working and getting things functioning properly again. And it is amazing. Like you were saying about all the different bitters. That's why I love Digest Forte. It's got all 5 of those bitters in there, and different, like gentian and sweet wormwood, all those things. It's great. I mean, my favorite power combo to give everybody that doesn't have an ulcer is, Zypan and Digest Forte. It just works for literally 90% of my digestive patients.
All right.
And full disclosure, to say before I even see people, I usually get them started in those 2 things for a little while, because it clears out all of the mess, right? You could be chasing all of these different symptoms that are just the result of poor digestion. And once you get that air cleared out, then you can really get down to what's truly, underneath all of that after the digestion's been taken care of, for sure.
Then they'll get better value out of the supplements that you end up giving them, because they're going to digest them better.
Exactly.
Supplements are food.
Right. Or the diet. Yeah. They finally get on. Now, both of you are experts chiropractors. What are the things that you're seeing structurally related to somebody having low stomach acid for a long time? That may be a sign for someone.
Dr. LeMay had talked about allergies. So C1, the top vertebra in the neck, goes forward when we have allergies, when there's some kind of an allergenic trigger. So vertigo, dizziness. Dizziness is typically an allergy of some sort. So if it's chemical sensitivity, and those they're reacting to perfumes, that often will set up dizziness and the head spins. If it's low stomach acid, then it's going to be food triggers that are causing those allergies, and that will cause a vertigo as well.
So you'll say C1 will actually get pushed forward. It'll actually move forward.
Rotate anterior on the right. So the adjustment for that is adjusting it, taking it backwards, if you will, on the right side. And that is what causes that vertigo mechanism, the dizziness, the spins. And so that vertebra goes forward with allergenic triggers. So that's a biggie, right? So often, I get, patients that'll come in at, complete vertigo attack and, can't whatever drive, or, they bring their other spouse, bring them in, and it's often a perfume that they've been wearing. Similarly, I had a patient that had 25 years of headaches, and she had left-sided headaches, and it was this perfume that she'd been wearing, the same perfume every day for 25 years. It was actually, in her case, inhibiting stomach acid.
Wow.
So, yeah. And that was a hero for her. He got her off her perfume, and after 25 years, that was done and gone. So
some chiropractors who don't really do function may find that they're constantly adjusting C1, right? They're trying to pull it back, and they never knew it was that lady's perfume, right?
They adjust C1, and then she puts her perfume on, and it goes right back out.
Right. Yeah. Wow.
So from a chiropractic perspective, and C1 can affect stomach acid to some degree as well. But T5 is a stomach-related vertebra, so that's if they're getting adjusted between the shoulder blades often. T5 is a stomach-related vertebra. The pec clavicular muscle, if you're doing bench press and you're going up crooked, that's a low stomach acid consideration. So those are there. Right side headache is gallbladder. You're thinking all kinds of stories, huh?
Yeah, no, it's just great. I mean, it's so good for people to know, because there's a lot of people that are told they need to come back 3 times a week, because they just keep doing the same adjustment, right. And they're never looking at the environment that's creating the subluxation, right? So now somebody who's been told they have to come back every week, perhaps they need to dig a little deeper or talk to, somebody about some function.
Right.
Beyond that.
I mean, yeah. I mean, we've got all the emotional. I mean, you said talk to somebody. We've got the emotions that go along with that too. Stomach is oversympathetic, low self-esteem, disgust. So was it, chicken or the egg, right? Was it this emotional barrage that caused the low stomach acid? The good news is correcting them nutritionally will help get them on the right track. But do we need to clear the emotional stuff? I mean, as a patient, those listening that are, health pursuers, if you know that you've had stomach issues ever since, you were sensitive to what was going on with your kid or that kind of thing, think about that event while you get adjusted. And that's a good way to, help yourself, if you will. I mean, so we can, if you're thinking about, whatever your dog died or the kid has, got bullied at school, think about that while you get T5 adjusted, and that's going to kind of lock it in. It's a way of doing this almost like a neuro-emotional technique or a tapping kind of a protocol.
Wow. Okay. Which is I meant to mention this earlier, which is another thing that we forget is that if you're in a state of fight or flight, if you're in a stress state, if you're working or if you're hurried, your body's not set up to even produce the stomach acid. So if you're throwing food into your stomach in that fight or flight state, which a lot of people do in the morning, they're setting themselves up for failure, right? They're setting themselves up for even worse problems. Again.
That's correct. Because boy, I tell you, how many people are on the fly, me included, and it's like, oh, am I all relaxed and in a parasympathetic state to be able to, digest and, get all my nutrients? The answer is typically no. It's usually not till I get home. But if I'm out running around working and stuff like that, it's like it's not. People are on the go running all the time, and they're not spending enough time just like relax and you're supposed to be eating in a relaxed environment. That's not typical for most people.
Right.
Yeah.
Don't do what Tony did. He was a buddy crashed his car while he was eating his lunch, taking notes on a phone call. He probably wasn't going to digest that meal very well.
No.
That's a crash and burn situation there. Right.
So Dr. LeMay, as we're wrapping this up here, what are some final thoughts that you would want if somebody, if they were able to listen to this, what's the most important takeaways that you want to empower them with to move forward with?
Well, and again, this is if you are taking any kind of acid blocking medications and or even stuff like Tums, which raises the pH of your stomach, I'm so like you need to find the solution to that problem right away. Okay.
For clarity, we want the stomach acid very low, just for those.
Yeah, because your pH of your stomach is should be at the pH of 1 to 3. That's highly acidic. I mean, it will just take apart everything like it's supposed to, especially protein. It's supposed to turn a hamburger into a broth within 1 hour. So you want it to be very low. And again, the other thing is what are you eating? Okay, are you eating real food? Okay, I'm telling my patients that USDA organic, is it, basically wild caught fish? I mean, just you got to have real food. If you're eating processed, bad food, which is the standard American diet. I mean, I grew up on Captain Crunch, which is not food. It's just a bowl of sugar. It's terrible. Yeah. I mean, just think about how much glyphosate was in that thing, Roundup and all the other stuff like that. It's just that's what we're eating. And people think that, well, if I just eat ramen noodle soup and have hot dogs for, dinner every single night, am I okay? And it's no, you're not. You're in big trouble. So, making sure that your stomach is functioning properly, because if you're having gasiness, bloating, indigestion, burping, all that kind of stuff going on, constipation, diarrhea, you're in trouble. You need to find somebody who can help you with that problem, because it's only going to get worse over time. All these things we were talking about down the road, headaches are, again, like Dr. V says, it's just a sign something's wrong, because people will say, well, I just have my, there's my normal daily headache. It's headaches are not normal. They may be common, but they're not normal. So look into these things, seek out somebody who can help you with this. Don't just cover it up with a medication. Medications are great at covering up symptoms, but they do not get to the root cause. I mean, just ask your doctor, because I've done this many times with MDs. Can you name me one medication that cures? And just listen to their answer.
Right.
Right.
So find the cause of the problem. That's what these doctors do right here. Justin and Dr. V, they find the cause, and then you can heal.
So if somebody's in Northern California or wherever they are in the world and they want to talk to you, Dr. LeMay, how do they find you?
Get online. You can find me, LeMay Chiropractic. I'm up here in Fair Oaks, California, which is a suburb of Sacramento.
Yeah, good.
Yep, nice
awesome.
area.
And are you able to help people, virtually if they're able to call in? Is that something that you offer?
Yeah. I basically have clients, patients all over the U.S. So
and do you have a copy
actually
of Dr. Verzal's book yet?
What's that?
Do you have a copy of Dr. Verzal's book yet?
No, I don't. It's a funny thing. It's just like it's never made it into my library back here. So it's like I got to get a hold of his book and do that. So yeah, I will definitely do that.
Let's do that.
Yeah, we'll get you hooked up for sure.
Right.
Good.
For sure.
So everybody can read along at home for the next few shows too. Make sure you get your copy of Dr. V's book.
Yeah.
Any last thoughts, Dr. V?
Yeah, well, I mean, I know we're starting to wrap it up. Shouldn't be throwing new information out here, but I mean, we're talking stress, and ulcer sort of paradigms. We should talk about the physical manifestations of stress, right? So that's L5. That's that low back pain right in the center of the low back. How chronic, how common is that, right? Yeah. And common, but not necessary, not appropriate, right? So that's a sign that the body's got too much. You're pumping out too much cortisol, not balancing life. The inner knee, the medial knee, the meniscus ultimately can get blown out, if you will, with chronic stress. Plantar fasciitis is a sign of chronic stress. Ankle weakness, the muscles that support the ankle, are a sign of chronic stress. Bunions are another sign of long-term chronic stress, where the foot is pronating, the arch is dropping, and that causes the chronic stress of the bunion there. So again, that's a sign that your body's been not handling stress properly. And then if it's inhibiting stomach acid, we talked about the ulcer, kind of a headache that would be in the front. Those are all potential signs of chronic stress, chronic cortisol. So that's another sign that would, get that handled. Then you wouldn't need the acid blocker kind of sort of medication. So again, body's trying to tell us a story. It's every pain in the body. We talked about headaches for sure, but every pain in the body is the warning light on the dash. It's your body saying, check the engine. So learn from it. Use tools like the Headache Advantage, and docs like you're listening to now to help figure out what these causes are, so that we can get to the cause instead of masking symptoms, creating much bigger problems down the road.
Even in cases where people think they're doing something more holistic, like getting a chiropractic adjustment too frequently, necessarily, right? That's a sign that it's not fully been answered yet, right?
Another sign of chronic cortisol problems is soreness after being adjusted. So POTS, right? Positional orthostatic hypertension, where the blood pressure drops. That's a sign of cortisol, right? That's a medical condition. And what do they have for that? Prednisone. Beat the adrenals even for. There's another episode for us. Prednisone, truth or trend. But that's another sign that if you get sore for a day and a half after being adjusted, that's another sign of a chronic cortisol as well.
Yeah. So speaking of, if anybody has any questions, anything we've said, please leave it in a comment below. Make sure that we're getting you the information. If you need to be able to find any of us, let us know. We'll find to make sure we can get connected with you. Dr. V and I do try every week to bring out a new topic. Next week, he doesn't know this yet, but we're tackling methylene blue, because it's been one of the most requested topics for people to understand whether or not this is good for you or not. And it's very confusing. So we're going to have to take that on. But any other topics that you're questioning, you think, you heard it on a podcast somewhere and you want to know, is this real? Is this part of nature? Or is this something crazy? That's what we're here to discuss. But thank you, Dr. LeMay, for bringing it back to all of this is secondary to this topic today, right? So important. Super grateful to have you here. Wish we could talk for a lot longer, but we're gonna say goodbye for today, and probably we'll have you back on in the future.
Well, thanks for having me. It's like I said, it's been a blast getting to hang out with you two, because I really appreciate you both, and I watched this show.
Yeah.
Nice.
That's awesome. That's good to know.
Ready for prime time.
That's right. You guys, hey, somebody's going to start, I think a cable network is going to start talking to you guys probably.
The world needs to know. That's for sure.
That's right. They need to know.
Well, thanks for watching, and thank you all for watching. You guys have a great week.